There is something happening inside retirement communities across the country that almost nobody is talking about, and the silence itself is part of the problem. Rates of sexually transmitted infections among adults over 60 have been climbing steadily for over a decade, and in some age groups, they have more than doubled. If you are over 50 and sexually active, or if you love someone who is, what I'm about to share with you may be the most important health conversation you've had all year. I know that is a bold opening. I mean every word of it. Here is the myth I need to destroy before we go any further, because it is the myth that is directly responsible for the crisis I'm describing. The belief that STDs are a young person's problem. That once you are past your 50s, past your childbearing years, past the recklessness of youth, the risk disappears. That responsible older adults simply do not need to worry about this. That belief is not just wrong, it is dangerous. And the reason so many people hold it so confidently is that it was never seriously challenged. Schools taught sex education to teenagers. Doctors assumed older patients weren't sexually active. Society decided the conversation ended at a certain age. So the myth calcified, and an entire generation of adults entered their most vulnerable years with no information and no protection. I'm Dr. Mariana, and I've dedicated more than a decade of clinical practice to the intersection of urology, sexual health, and aging. What I see in my patient population, and what the data from public health agencies now confirms, is that older adults are experiencing an STD epidemic that is largely invisible because we don't talk about it. Today, we are going to talk about it because knowledge is protection, and because every person in this audience deserves the dignity of honest medical information, regardless of age. Before we go further, if this is your first time here, please subscribe and leave a like. It takes 2 seconds and it allows this content to reach the people who need it most. And drop a comment letting me know where you're watching from. This community of thoughtful, health-forward men and women spans every corner of the world, and I am always grateful for it. Let's get into the real reasons this is happening and why retirement communities specifically have become ground zero. The first reason is the biological reality of aging bodies, and it is one that almost no one discusses with older adults. In women, the hormonal changes of menopause cause the vaginal lining to thin and lose natural lubrication, a condition called vaginal atrophy. This thinning dramatically increases the likelihood of microscopic tears during sexual contact, which are precisely the entry points through which viruses and bacteria cross into the bloodstream. In men, similar hormonal shifts reduce the resilience of mucosal membranes. In plain terms, the biological barriers that once offered some degree of passive protection are weaker after 60. Think of it like this. If a younger body's skin is a thick leather glove, the aging body's equivalent membranes in intimate areas are increasingly more like tissue paper. That is not a reason to stop being intimate. It is a reason to protect yourself with far more intention than you may have done in your youth. The second reason is the social reality of retirement itself. For many older adults, this is the first time in decades they are single. Divorce, widowhood, the restructuring of a life that had revolved around family and career. These transitions often occur simultaneously with a genuine reawakening of desire. Men and women in their 60s and 70s are rediscovering intimacy, often with new partners, often in communities that actively encourage socializing and connection. This is genuinely wonderful. I celebrate it. But here is what is not happening alongside it: the conversations about protection. Dating at 65 is not the same as dating at 25, not because desire is different, but because the community around you is not handing out condoms and informational pamphlets. There is no peer culture reinforcing safe practices. There is no health class. There is often not even a frank conversation with a doctor, because many physicians remain deeply uncomfortable raising sexual health topics with older patients. The third reason is the pharmaceutical revolution in sexual health over the past 2 decades. Medications that restore intimate function have given many older men the ability to be sexually active well into their 70s and 80s, which is genuinely a gift. But those medications were never accompanied by the sexual health education that should have come with them. A man in his late 60s who has a new partner and restored bedroom reliability is no less at risk for an STD than a 25-year-old. He is, in some biological respects, more at risk. Yet the messaging around these medications focuses entirely on function and says almost nothing about protection. The result is a generation of sexually active older adults with the capability but without the corresponding knowledge. I want to pause here and ask you something directly. Have you had a conversation with your doctor about sexual health in the last 2 years? Not about function, about protection. Drop a comment below. You do not have to share details, simply yes or no. I want to understand how often this conversation is actually happening, because in my clinical experience, the answer is almost never. The fourth reason is what I call the pregnancy assumption, and it is one of the most quietly consequential false beliefs in modern healthcare. For decades, the primary public health messaging around condom use centered on pregnancy prevention. Condoms prevent pregnancy. Condoms are for people who could become pregnant. And so, the moment an older woman went through menopause, the perceived logic for barrier protection evaporated. Nobody explained clearly and directly that condoms primarily prevent the transmission of pathogens, and that function does not expire at any age. Nobody sat down with a 60-year-old woman and said, "You cannot get pregnant anymore, but you absolutely can contract herpes, gonorrhea, chlamydia, syphilis, or HIV, and your body's ability to fight those infections is not what it was." That conversation did not happen. It still frequently does not happen. And so a woman who was careful throughout her reproductive years enters her postmenopausal dating life with the sincere and completely incorrect belief that she no longer needs to protect herself. The fifth reason is the specific bacterial and viral landscape facing older adults. And this is where I need to be very direct with you. Gonorrhea and chlamydia have both seen sharp increases in the over 55 population. Syphilis, which many people associate only with history or with specific younger demographics, is resurging among older adults at a rate that public health officials describe as alarming. Herpes simplex virus is extraordinarily common and frequently asymptomatic, meaning a person can transmit it without ever knowing they carry it, and an older adult may never have been tested because it was never considered relevant to their age group. And HIV, let me be very clear about this, is not a young person's disease. New HIV diagnoses in adults over 50 represent a growing percentage of all new cases every year, and older adults are frequently diagnosed later because neither they nor their doctors considered it a possibility. Late HIV diagnosis means more advanced disease at the time of treatment. That is a consequence of stigma and silence, not medical inevitability. The sixth reason is the testing gap, and I want every person watching this to hear the following sentence carefully. Most older adults have never been tested for sexually transmitted infections as adults. They may have been tested decades ago during a routine pregnancy workup. They may have been screened during a college health visit in their 20s. But a 68-year-old man who has been married for 30 years is now widowed and has begun dating again. That man has, in all likelihood, never had a frank sexual health screening. And neither has his new partner. Both of them assume the other is clean, because both of them associate STDs with a version of themselves they no longer are. The result is that infections pass silently between people who never imagined it was possible. Think of testing the way you think about a smoke alarm. You do not install it because you expect a fire. You install it because you respect the possibility of one, and you refuse to be caught without warning. Let me tell you about James. He came to my clinic at 71, 18 months after losing his wife of 43 years. He had begun seeing someone, a woman his age from his community, and their relationship had become physically intimate. He had not used protection. The thought had not occurred to him. He came to see me because of unusual urinary discomfort, and what we found was a bacterial infection he had contracted and, unknowingly, been passing back and forth with his partner. He sat across from me in the examining room with a look I know well. Not shame exactly, but the particular confusion of a man confronting something he had genuinely never considered. He said, "I thought this was something you just didn't have to think about anymore." After treatment, after a full panel of screenings for both him and his partner, and after a long, honest conversation about barrier protection and testing, he told me that what he wished more than anything was that someone had talked to him about this before it happened. I am talking to you now, before it happens. I want to speak directly to anyone who feels embarrassed hearing this conversation, who assumed that by this stage of life they had aged out of vulnerability. I understand that feeling. There is a version of aging in our culture that promises a kind of earned immunity from certain concerns, as if longevity comes with exemptions. But your body does not negotiate those terms. Your immune system is doing more work with fewer resources than it did 30 years ago. Your mucosal barriers are more permeable. Your capacity to fight off an infection that goes undetected for months is more limited. None of this diminishes you. None of this is cause for shame. It is cause for information. And the single most powerful act of self-respect available to you right now is deciding that your sexual health is worthy of exactly the same attention as your blood pressure, your cholesterol, and your bone density. Here is your action summary. First, use barrier protection, condoms, consistently with any partner who has not been recently tested, regardless of age or life stage. Second, ask your doctor for a full sexual health screening at your next visit. This should include gonorrhea, chlamydia, syphilis, herpes, and HIV. If your doctor seems reluctant to raise it, you raise it. You are entitled to this conversation. Third, if you are a woman over 60 who is sexually active, speak with your gynecologist about vaginal health and whether hormonal support could restore the protective tissue that aging has thinned. This is a medical decision that can meaningfully reduce your biological risk. Fourth, do not assume your partner's history without a conversation. A gentle, direct, and dignified conversation about testing before intimacy is one of the most loving things two people can do for each other. Fifth, if you have not been tested in the last 2 years and you have been sexually active, get tested now. Not because you are irresponsible, because you are informed. Sixth, share this video. Send it to someone you care about. The conversation that prevents one infection is worth every moment of discomfort it takes to have. Your 30-day challenge is this. Within the next 30 days, book a sexual health screening and have one honest conversation with your doctor, your partner, or both. That is it. One appointment, one conversation. It is the most direct investment in your own protection you can make right now. If this reached you at the right time, please subscribe so you never miss what comes next. Leave a like if this changed how you're thinking. And in the comments below, I want you to answer one question. Did you know that STD rates in older adults had been rising before watching this video? Yes or no? That is your comment. I will be reading everyone. Aging is not the end of vitality. It is an invitation to live smarter.